People utilize cardiovascular training to lose weight. No, the purpose is not to lose weight, it's to improve your cardiovascular system. That's what it is. And chances are you're not going to lose a lot of weight, because if you see the amount of calories that you expend after 45 minutes to an hour on the treadmill or on a bike or anything else like that, probably equates out to a half a donut.
Welcome back to Achieving Unlimited Health. Last time, Dr. Cima shared how the physical injuries can evolve into chronic pain and degeneration. Today, we're diving deeper into the physical side of the triune, exploring stability, movement, and what your body truly needs to recover and thrive over long-term and live a healthy life. So nice to see you, Dr. Cima, as always. Excited to continue this episode and really continue with your presentation and learn all this great knowledge you always share with us.
Thank you, Layla.
Let's dive in. So conditioning the human body.
Yeah, so what we talked about the last time, and a lot of times people get confused with this. You know, what we want to do is care for the human body, and then, which we talked about how you do that the last time, different kinds of treatment that you would need. You know, once you get the human body as stable as possible and feeling as good as possible with no pain, now you want to condition it. It's kind of like a car. If you're going to race your car, you're going to have to tune it up. You'll check the whole front end, make sure the tires are not worn out, and make sure everything is running properly. Then you go race the car. You don't race the car first and then find out that the tires aren't good and the front end's out of alignment and you crash. That's not what you want to do. So what you want to do is, first of all, care for the human body. And then once you can care for it and it's in fairly good shape, which means you have really no pain and you're fairly functional, now you want to condition the body and make it stronger, more flexible, with all the rest. So there's literally 3 types of exercises that you can do to condition the human body. And everything falls into one of these 3 sides. So you have stretching or flexibility. That's one. Everybody needs to do that. Strength training is number 2, and aerobic cardio is number 3. Now, if I had to pick the 2 most important ones, it would be strength training and stretching. Aerobic cardio, that's okay. But, and again, most people tend to utilize that portion of the exercise triune more than the other sides, because it does take a little bit more of an understanding with strength training and also flexibility and stretching, where with aerobic, you can just get on a bike and you'll be fine, you know, to a certain degree. So today all we're going to do is talk about how you condition the human body and guidelines that you need to follow. As long as you follow these, chances are you'll condition the human body without injuring it. Because a lot of times when people are trying to condition the body, they're pushing way too hard and they're going to hurt themselves. And usually 9 times out of 10, that's what they do. So we'll continue on right now. So if you have any questions, feel free to just, jump in and ask me.
All right, absolutely.
When we use physical treatment or exercise, what we want to do is we want to use, again, cardiovascular. I call it progressive resistance with the weight training, because that's the most important way to train with weights. And also flexibility is really important. And again, most people, when I talk to them, I say, do you stretch? And most people don't stretch. I mean, the patients definitely, it's like, I would say 90% of them don't stretch. And it's like, that's the least expensive. You just lay down on the floor, or the bed, and that's it. You don't need to put on clothes. You don't need to do this. You don't need to travel anywhere. You can just do it in your own bedroom. And people just don't do it. I don't understand why, because you're going to feel so much better. So much
better.
You really do. Same thing with the wrist. Yeah. So it's a situation where it's not something where it's hard to do. They just elect not to do it because they don't think it's going to really help that much. And I would say that out of 9 out of 10 patients don't stretch. And maybe the one that doesn't really stretch properly. Because the stretches that they'll try to do that'll hurt them, they won't do. So, and there's a way to work with those so that this way you can go through every range of motion. And we'll discuss this this way. People and patients get the right ideas to what's going on. So the first one we're going to do is guidelines for cardiovascular training. Now, people utilize cardiovascular training to lose weight. No, it's not. The purpose is not to lose weight. It's to improve your cardiovascular system. That's what it is. And your chances are you're not going to lose a lot of weight, because if you see the amount of calories that you expend after 45 minutes to an hour on the treadmill or on a bike or anything else like that, probably equates out to a half a donut. So you're not going to really get that many calories burned unless you're doing marathons. And not many people are going to be doing marathons. So the guidelines, not more than 3 or 4 times per week at 30 to 40 minutes. That's all you really need. You don't need to be on there for hours on end. It's really ridiculous. You just want to basically get your heart rate up, and we'll tell you exactly what to do. So taking resting heart rate and respiratory rates, that's really important. So you should just check your resting heart rate and also your respiratory rate. And as you start doing that, then you're going to take your target heart and respiratory rates and do not exceed more than 80 to 85% of resting heart rate. So let's suppose your resting heart rate is maybe 70 beats per minute. So you want to either be 80% or 85%. So that would be, somewhere around 110, beats per minute. You don't want to go any higher than that. That's good. And again, unless you're like really intense and really, trying to get into a race or anything else like that, but we're just trying to do things to help stimulate the heart. And always write down time and distance, and really go for more time with increased distance. So you don't want to keep on pushing time. Just go a little bit further if you feel like I can do that. And just get to a point where you feel comfortable with whatever you're doing. And you're stressing your heart because she got the beats up to 100, again, 110, 120, 130. It really depends on your pulse rate. But that's exactly what it is that you want to do.
So is that what the average should be? You said 120 to 130. That's where you want the heart rate to be?
And it depends on what your respiratory and heart rates are. Like if, for example, if your respiratory rate is somewhere between, 12 or 15, respiratory in and out per minute, then you would probably look at multiplying that by 80%. So you wouldn't want your respiratory rate, if let's say it's at 12, to get up to more than 18, 19 or 20 within that minute time frame.
Okay.
Okay. So you want to push your lungs and your heart, your whole circulatory tree, but not just, annihilate it. That's the big thing that most people tend to do. They'll be on the treadmill for 45 minutes, 50 minutes, pounding away. And again, depending on what you're on, sometimes, patients will basically, they'll have low back problems, and they'll say, well, I want to do, whatever it is. I want to do the treadmill, or I want to do a bike. And they may not be the best things for you at that time, because it can really irritate low back problems. So you have to be really careful when you're choosing a cardiovascular exercise. For example, swimming would be a real good one for most people, because you take the effects of gravity off the body and you're exercising literally the whole body at the same time. And it's a great cardiovascular exercise. And some people would rather walk. And again, if you're walking or you're jogging and stuff like that, we spoke about that the last time, you're putting a tremendous amount of stress into the sacroiliac joints, 2 to 3 times what your body weight is. And it's step after step after step, mile after mile after mile, day after day after day. It'll traumatize the whole sacroiliac joint. So again, you have to look at that.
Sorry. That's interesting as well, because I think when people think about cardiovascular training and working out, especially if they're trying to lose weight, people may not realize that 3 or 4 times a week is even the ideal amount of time. Most people might think they have to do it every day.
7 days a week. Oh yeah, I got to do 15,000 steps. I got to do this. I got to do that. That's not what you want to do. You just want to focus on, doing this 3 to 4 times a week. You can do it a little bit more if you want to, but that's a good amount of time to do that. And these are like suggestions that you would utilize to prevent, further injuries or trauma to the body. So any more questions on the cardiovascular?
No, ready for the next slide.
Good. So guidelines for flexibility training. This is a great one. Okay. Stretch daily for 20 to 30 minutes. Really, when I see people stretch, they stretch for about 20 or 30 seconds.
Yeah.
And that's about it. They stick their arms in the air. They move them around. They might do a squat or so or something else like that. And that's it. So, and it may be a good idea to stretch 2 times a day on the days you train. I always tell my patients, I say, look, it's important to train. I mean, it's important to stretch before you exercise. And sometimes it's even more important to stretch even after you exercise because everything
Right.
gets really tight at that point. So it's a good thing to do, stretching in 20, 30 minutes isn't a long time. So if you sit down at night and you put the TV on, and you start stretching within 20, 30 minutes, you pretty much have all the stretches done. So
Absolutely.
again, stretch once before training and then again in the evening. That's what I usually recommend for most people.
And are there any particular stretches that come to mind that you think are
Yes.
beneficial? There's so
Yes.
many, right?
Yeah. Here's the thing. When I was taking, way back when I started to get into the martial arts, Taekwondo, and they had a whole stretching that was every day was stretching. And, I remember when I took the course or when I was taking it to get my belt, my black belt, it was kind of like I looked at all the stretches and every stretch that they had you do took every major muscle, every major joint through every major range of motion. And that's what you have to do. And if you can do that, then it's probably about 15 to 20 stretches that'll help you go through that. Because a lot of times patients will just do 4 stretches or 5 stretches. And then I'll say, well, did you ever do this one? No, it hurts. That's what you really have to do. You have to figure out why that hurts and get that range of motion within that joint or joints. So it's equal. The left and right sides are equal. So it's really important when you are stretching, you treat it like it's a program. It's like, I want to stretch and make the left and right sides of my body equal. I don't need to be Gumby. I just need to have the left and right sides of my body, whatever stretch it is, it's almost like identical. And a lot of times you'll see the left side is like really tight and the right side is nice and loose. So people tend to I just do it on the right side and then neglect the left side. And that's what you shouldn't do. You got to be able to go through every stretch and make sure that it's equal left and right. And whichever side is the tight side, I always tell my patients, then you stay more with the side that's tight as opposed to the side that's kind of more flexible. So you get that equal balance in there as well.
Absolutely.
Okay. So, and again, now that's for stretching. So it's, once you know the 15 to 20 stretches, and I do have a booklet that I give to my patients that literally shows them the stretches, how to perform them. And they're basically lying down, seated and kneeling and then standing too as well. And that's the ones you really want to start doing. You want to start with lying down stretches and then graduate to, standing up and having your whole body weight on the body and the stresses of gravity on the body too as well. Then it's like you better have your body nice and flexible and warmed up at that time.
So that's interesting. You recommend starting off with floor stretches.
Yes, all the time. Okay. Well, it's easy. The effects of gravity on the body. Now, again, I have patients that are coming in that they're in their 70s or 80s, and they can't get down on the ground. And so I tell them, I said, then do it in bed. There's a lot of stretches you can do in bed, and it's a lot easier to do them in bed than it is, on the floor. And you can eventually graduate and get back onto the floor, but for the time being, just use your bed or use a chair.
That's such a good idea.
It's going to really help you.
And would you recommend, let's say someone, regardless of age, but hasn't really been active or kind of fell off of their workout routine or their stretch routine, or maybe never had a stretch routine, would you recommend that would be the first thing for them to do would be to start on the floor or maybe on the bed even?
Yep, absolutely. And I would check them and see, usually we have our trainers, check them out because we have, right in a health facility, we have tables. They may be 8 inches, 10 inches, 12 inches off the floor, and they're really well padded. So it's almost being like on your bed. And then we can have the trainer work with the patient and show them this is the position that we want you to be in. Because again, when you start putting people into flexibility positions, one side feels fairly normal. The other side feels like, I don't even know, I'm not even sure where my leg is or if it's in the right place. No, it's true. So, and then you'll start to see the more you do both sides equally and get both sides to become equal, then you'll have a really good balance in the body and you'll start feeling better. You'll start feeling a lot more loose in the joints. And
Right.
it's really important as you get into your 50s, 60s, 70s, that besides losing a lot of strength, you lose a ton of flexibility, a
Hmm.
ton.
It
So,
is. It's something even I've noticed as I'm I'm
yeah,
getting a
oh,
little
yeah,
bit older. I'm like, I used to be so naturally flexible from taking dance as a kid
yeah,
or playing
oh, yeah,
basketball. And now I'm
yep,
like, wait, okay, tying my shoe
yeah.
isn't as easy as it used to be. And I haven't I'm
No,
taking notes. I need to do some floor stretches today. And you
yeah.
said it earlier, you really do feel so much better
Oh yeah, no,
about
and yeah, I
everything.
get up. Once I stretch out, I get up and I feel good. And you know what else is too? That's really good about that,
Hmm.
especially if you had a really intense, tough day, and I don't care if it's physically, or mentally, emotionally.
Hmm.
When you stretch out at the end of the day, your whole body kind of calms down, and
Hmm.
it kind
It
of
is
makes you feel like
relaxing.
it allows you to sleep better through the course of the night too. Yeah, that's exactly what's going to happen. At the end of the day, you stretch out, you're going to feel a lot more relaxed and a lot, let's say, when you go to bed, you'll be able to go right out.
Hmm. Absolutely. And
And
you'll
if
have
you,
probably a much better sleep, I'm sure.
yeah, and if you start incorporating the strength training, that's going to really make you sleep like a baby. So, but then there's really important guidelines for strength training, which we're going to kind of go through, and you're going to be amazed, like with strength training, like how what the possibilities are and what you gain from it. And most people just don't do it because they
Mhm,
don't know how to do it. So we'll go guidelines for the strength training. A simple explanation of how many sets, reps, and times per week you should exercise. Because
mhm,
again, people do take this to another level and really push it, and they're not supposed to. So repetition range should be 10 to 15 repetitions for women and 5 to 12 for men. This way it'll give women more, let's say, leaner muscle. With men, it'll give them more muscle mass at the
mhm,
same time. But again, these can change a little bit. Okay. Guidelines, no more than 2 body parts plus airs per day. Okay. And train at least twice with no more than 4 weight training sessions per week. So you're only going to do this 3 or 4 times a week.
mhm.
And each session should last between 30 and 60 minutes, including stretching and abdominal work. So, again, with the strength trainers, it's not like taking your body and trying to annihilate it, like I see most people attempting to do. They just, you want to just take it nice and slow and build up nice and slow. Now, could you do more than that? Let's say, yes, I want to get into more of a bodybuilder or go to a competition. That's a different story. But for the
Yeah.
average bear, this is plenty. This is plenty of things to do as far as that goes. So,
Mhm. It is
and
true,
then,
like you said about annihilating
no,
yourself,
that's
which
what
makes
people do. I see them in the gym and I'm like, what are you doing? And
and
they're
people when they
yelling.
start, they jump into it. I know I'm
Yeah.
guilty of that too. I went from years ago not working out at all to doing high intensity training at F45 when I was in Florida
Oh, yeah,
for
yeah, yeah.
6
Okay.
days a week. And the trainer was like, "You're gonna hurt yourself. You need to not do this as
No,
often." And there's kind of that mentality of, especially if you haven't been in a routine or have fallen off and you want to get back into it, you have like
no.
an all or nothing mentality almost. I need to do the
That's,
most. I need to do the heaviest weights. I need to
no,
go for an hour and a half a day, five,
no,
6 days a week. So it's
no,
good to hear that almost
no.
less is more
Yeah.
consistency and just
It's much
being
better that way. And,
exactly.
and here's the thing too. When I started lifting weights, I
Mhm.
was, 165 pounds. I
Mhm.
was 5'10". And, so I had really, I mean, I was fairly like active, as a kid. I boxed, I did all these different things, but I was really lean and I
Mhm.
wanted to put muscle on. So I went from 165. And again, this took 5 years. It wasn't like it took 5 days or 5 months
Mhm.
or something else like that. But from 5 years, I went from 165 up to 245. And it was
Wow.
just nice and slow, but it had a lot to do with eating and training really heavy. Now, would I recommend most people do that? No. It
Mhm.
was just too much work. It was just too hard to try to do that. And at the same time, having to practice and having a family and everything, it did put a lot of constraints on me as well. So what I wanted to do too when I was working out, see, I didn't want to wait 4 months to notice that I didn't do anything. I worked out, and I look at the mirror and I say, nothing changed. So I start to look at what they call body monitors. So when you're working a muscle, exactly how hard you're working it without going crazy. So the first thing that you're going to get, and that's why I tell people when you get really good at this, you stop counting reps. You don't ever count reps after this. You look at the body monitors that you should feel when you're working out. So there's something called a burning sensation that should be achieved if the muscle is being worked by the second or third set. So if you do, let's say, a set of biceps and you add a little bit more weight by the second or third set, you're starting to feel a burn in the muscle. And that burn is just a buildup of lactic acid and metabolites in the muscle that is showing you're working the muscle real hard. And
Right.
that's
what
good.
they say, right? Feel the burn. That's say that's where it came from.
Yeah,
Got
just
it.
feel the burn. It's once you get the burn, then you know you're on the right path.
You're doing something right. Yeah.
Yeah, and then the second thing you'll get now, you'll deserve this because the burn is not the exact nice feeling that you'll get, but then you'll get a pump in the muscle or tightness in the muscle and the surrounding skin, and that should follow the burn. So now you're getting the pump put in there, and the pump is basically when you build up, when you're working, and you're getting those those metabolites built up in the muscle. Now the muscle can now start to flush everything out. And as it starts flushing out, more blood comes in, and now you start to get the pump in the muscle. And you look at it, and you start to see definition, and you start to see the muscle getting a little bit bigger, and you kind of see some shape to it. I remember when I was first working out, the first time I saw my bicep muscle, I was like, look, there was a little indentation in my bicep area. That was about it. And I was psyched that I got that. So, but it was kind of like, okay, that's what I have to do. And then once you get once you get the pump, okay, you'll keep that for as long as you can. And then, that's it. Once that pump starts to go away, then, the next 2 days or so, you should have what they call DOMS. Your muscle should ache and there should be some soreness and it should be present when you touch the muscle, but not where, your muscles are so sore and so painful that they just hurt to lift up your arm. That's what you don't want. You want to be able to work the muscles, but then have them feel like, okay, they got work really well. And at this particular point, now they need 2 days or so, 3 days to get themselves back into a healing mode. So it takes usually, again, if you train the muscle properly, it takes 1 or 2 days and you'll get that, what they call DOMS, delayed onset muscle soreness. And this way, what will happen is that once that starts to go away, then the muscle's healed and it's ready to go again. So if you're going to do that, if you're going to do that muscle, you want to make sure that by the time the next time comes, that soreness is away. And we'll go through that again too, and we talk about more with the strength training. Do you have any questions?
No, I was just going to comment. I know when you work out, and especially if you're not used to it, and those muscles hurt, you're out for the next few days because you're in so much pain that you can't even think about working out again or lifting any weight.
No, and that's what you want to do. You want to now give yourself a chance for your body to heal itself. And chances are you won't get injured. And as long as you're stretching in between, that'll be perfect. Okay. And then always increase your weight on each set, but never substitute that form for more weight. And that's what I see most of the time, even in my facility. It's the people try to get into like lifting more weight, and then their form is horrible. And, they're using gravity and momentum to move the weight. And it's an excellent way for you to start causing all kinds of injuries to your body by doing that. So it's always like you can increase your weight, but never, if you can't do it with excellent form, don't do it. That's what I tell people. If you can't have excellent form while you're doing it and you got to go too fast or whatever you got to do to compensate for what's going on, then you're going too heavy. And that's going to always that's going to cause injuries without a doubt. So also guidelines for abdominal training, and again, most times that I see, the biggest problem with most people is their abdominal area, especially with the men and with women too. They don't train their abdominal area properly, and they use different muscles to train their abdominal area that cause their belly to stick out as opposed to be pushed in. I'll watch people working out, and I'll say, let's like, for example, a leg press. I watch people on the leg press, and when they're pushing the weight up, their belly is like sticking out. It's like, no, your belly's got to be pushed in. There's two types of muscles. There's a whole bunch of muscles that make up the abdominal area, but there's the two things that they do is what they're called intrinsic and extrinsic muscles in the abdominal area. The intrinsic muscles push your stomach in. The extrinsic muscles push your stomach out. So if you have a big, heavy meal, you want that extra, space to digest the food. So a lot of times when people are working out, they're using extrinsic muscles to work out with in the abdominal area, and it's getting bigger and bigger instead of smaller and smaller. But if you watch really good bodybuilders, they have, as far as the abdominal area, if they know what they're doing, it's always perfect. Though it's not just flat; it basically has shape, has size, and symmetry to it. I mean, you can be training, every set that you do, you can be training the abdominal area. And without even realizing it, but that's what you want to start doing. So when I have people working out, I'll say, okay, assume perfect posture first before you even lift the weight. I want to see your shoulders level. I want to see your head level. I want to see your arms, this far away from your body. And I want the left and right arms to look perfect when you're doing this. So it's the same thing with the abdominal area. So you want to start doing that so you can at least make sure that, and again, people say, I want a flat stomach. No, you want an abdominal area that has shape and symmetry, to it. So it looks like it's not just flat, but it looks good. So, and you can do 2 or 3 sets lying down and 2 or 3 sets standing crunches and daily, or at least 4 times a week. I used to let people say, well, you can do exercises for your abdominal area, but now I recommend that I don't care what exercise you're doing. I don't care what day you're doing it on. You always include the abdominal area. And the more you do that, the more you're going to just walk around and you're going to keep on strengthening those intrinsic muscles, and you're going to start to see your tummy get flatter and flatter. Now, there's also a nutritional component to it that a lot of people will deal with. But if and again, there's certain patients, especially middle-aged men, they'll have a lot of belly fat. And not so much on top of the muscle, but below the muscle around the organs, which causes like everything to really get hard and just pushed out even more. It really chokes your organs at the same time. So I always recommend, with people now, you can do some abdominal work, and I do it, but the majority of the time I'm doing it while I'm exercising. So I'm tightening my stomach. I'm looking at it from the side, and I'm utilizing my abdominal muscles all the time to basically stand and sit and lie down and all the rest. Then I just condition those muscles to do that all the time. And when you do that, you're doing it like unconsciously. And that's what you want to get to that point. So when you go to stand up, you'll immediately just, tighten your belly up. So because you're conditioning your muscles through your mind and getting everything to work the way it's supposed to work. So, and reps should be between 15 and 25% if you're doing abs. But like I said, you can do that, but I always recommend that you do the strength training for your abdominal area with every exercise you do, whether it's legs, whether it's chest and back, whether it's arms. That's the way you want to do it. And if you look at like really good bodybuilders, they're more into, they'll pose, which is really tough, because when you're posing, you're trying to get each muscle in the whole entire body to kind of expose itself and to see like all this balance and symmetry that you created. And it's something that you really have to focus where your mind and muscle become one. So you can contract the muscle without even having any kind of weight to contract the muscle with. So a lot of professional bodybuilders, a lot of good bodybuilders will do a lot of posing. They'll pose more than anything else because it really, it shows you what your muscles look like. It'll kind of show you like what areas you need to work on, and you kind of expose those weaknesses in your body. And that's when you want to start utilizing all different kinds of exercises to basically make that happen. So, now here's the thing with bodybuilding. And again, it's got a bad connotation because bodybuilders, they think building a body is just for bodybuilders. But bodybuilding, the way I look at it, is the use of progressive resistance exercises. The muscles themselves, there's 2 ways they grow. One is called hypertrophy, where the number of fibers stays the same, but they become bigger and thicker. Hyperplasia, and they're not even sure how this even plays, but hyperplasia means that you've basically created more muscle fibers at the same time. Now, the key with this is that the stronger you make your muscles and the more active you make your muscles, the more calories you burn. And it's not that burning calories like while you're exercising, you're burning calories 24/7. So that's why with weight training, it's a lot better than cardiovascular, because when you're doing cardiovascular, for the 45 minutes you're exercising, you're burning calories. For the next day or 2 days or 3 days before you do it again, you're not going to be burning anything. With weight training, you work out for an hour and a half, you get put on some muscle mass, and as time goes on, those muscles are burning calories 24/7. So you're not just burning calories while you're exercising, you're burning calories while you're sleeping and while you're walking, while you're doing anything. And that's what you really want to start to get your body to do. And if you can do that, then you won't have any problems with weight. So you'll be able to, like, my weight went from, like I said, 165 to 245. Now I'm around 200, and I can go from 190 to 200. Like, I know what I can do to, like, change what I have to do without killing myself. And then people will say to me, well, how many calories you take in a day? And I'll say, probably around 3,000. And they go, 3,000 calories? It's a lot of calories. Well, yes and no, because if your body can burn that many calories and sustain your basal metabolic rate, then that's what it burns. And that's what you have to eat. And that's the other thing that people, kind of fall into the trap with. They feel like, well, if I got to lose weight, I got to decrease the amount of food I'm eating. And it's like, a lot of that stuff never makes sense to me, because you want your car to go faster, you give it more gas. You want the fireplace to burn brighter, you give it more wood. You want your metabolism to go stronger, you give it more calories. And that's what people are really afraid to do by giving it more additional calories, because they think that calories are going to become fat or whatever they think it's going to become, and you're going to have problems with weight. But if you train properly, you exercise and not crazy, and you eat properly and not crazy, then you'll basically create the body that you want to create. And it's just, and over time, it's really simple. You don't give yourself like 3 weeks or 3 months. People, especially now after the holidays, they just want to basically get into this insane, okay, I'm going to lose weight. I'm going to do this. I'm going to exercise 6 times a week. I'm going to cut down my calories, and they slow their metabolism down by doing that. They just don't realize it. And then by doing that, you just, you're causing your body to work harder and not getting any results from it. So.
Right. And it's that, like you said, the beginning of the year, it's all these New Year's resolutions, and then it's all the, the few pounds most people put on during the holidays. So, and we're always been taught to, work out more and eat less, and that's the way we're going to lose
that's
weight.
what happens. And you're going to get yourself, you're going to get yourself into trouble, because you want to eat a good amount of food. You don't want to be a pig. You want to eat the right foods, and you want to exercise a certain way. And if you do that, you'll control your weight all the time. You'll know exactly what to do. So the 3 purposes of bodybuilding are, and these are the best things, is number 1, create a pain-free physique. That's what I like. You got to be pain-free. I just know, because I deal with patients all the time. They're in pain. And it really causes a lot of issues with their life, with their health, and with their ability to do different things. It also creates a functional physique, so that this way, besides having a pain-free physique, you're functional. So if you want to play football, you want to play tennis, you want to play golf, you want to play pickleball, whatever it is that you want to play, you'll do it at the best of your ability. And it also creates an aesthetically pleasing physique. That's the thing that most people, that's the hardest part of the bodybuilding thing, because you can change your total physique with weights, totally change it, and make it aesthetically pleasing, where the left and right sides of the body look the same, where the upper and lower body looks like they belongs on the same body. So you can change your overall physique. And that's what I like about it, because that's what people want. They just want they want a nice physique, and most people don't get it. And then they'll go with these, with the shots now, with the whatever. that they're taking for weight loss, and they're not going to realize that it's not going to change their physique. It's where they would basically, bulging out. They're going to be like, they're going to be sagging in those areas. So you don't really create any kind of an aesthetically pleasing physique with stretching, with cardiovascular. It just doesn't do that. With weight training, you'll definitely do that. But it takes some time, it takes some understanding, and it takes, a really, let's say focus to do all these different things. So, in bodybuilding principles, it is distinct from similar activities such as powerlifting, Olympic lifting, because it focuses not only on strength, but physical appearance, functionality, and the elimination of pain. Whereas the powerlifting, the Olympic lifting, chances are you're going to get hurt because you're just going as heavy as you can. And it doesn't really change. It doesn't really improve your physical appearance because you're only using maybe 3 or 4 different lifts, and that's about it. As opposed to where bodybuilding, you have maybe 20, 30, 40 different exercises that you can do to help shape, the whole entire body. So it's functioning really well. So these are the many purposes of progressive resistance are to increase strength, like we said, increase muscle quality, size, and shape. That's 2. Increase stamina is 3. Increase cardiovascular ability is 4. And increase flexibility, which is 5. And then we have improves your posture, which is really important. Most people don't even think about posture anymore. No, I'm serious. It's scary.
I'm laughing because you said my exact thought. I quite literally thought most people don't think about posture, and you said it exactly at the same time I thought it. Because you don't. You're not cognizant of it.
I remember I was probably like 12 or 13, and we had a bay window in the house, and I was outside with my friends, and I came back in, and my father said, "You look atrocious." I said, "What are you talking about?" He goes, "You're like, it was cold out, and I had a jacket on, and I was trying to I wasn't any kind of good posture." But he said, you got to stand tall. You got to stand with good posture. And I never realized that I was even doing that when I was 12 years old. And he says, that's what you're going to have to start doing. And I see all my patients. I tell them, I say, if you don't get your posture proper right now, it's going to get worse as time goes on. And the way it gets worse, especially with people in their 50s, 60s, and 70s, you kind of like fall forward. Your whole center of gravity in your body's forward. So if you look at people in their 60s, 70s, and 80s, they're not walking, they're falling forward. Their head is like maybe sometimes 6, 7 inches in front of their body. And we talked about that the last time, where it's like, it's the weight of a bowling ball times 3. So you put all that extra stress on the spine, and so eventually all the joints in the body get thrown out of alignment from the effects of gravity, and then the walking becomes worse and worse as time goes on. So it improves muscle balance, symmetry, and body shape. That was the greatest thing I liked, because when I was starting to lift weights, it was like, I can change my body, I can make my pecs bigger, I can do this and all the rest, and that's what it did. So it improved process, improved muscle balance, symmetry, and body shape. Improves body function to enhance your ability in any sport, which we talked about. Improves mind function, balances right creative brain and left analytical brain activity. That I got to explain, because this is pretty cool. When I first started lifting weights, even when I was a kid, they were like, don't lift weights. Why? You get muscle bound. Whatever that meant. Nobody knew. And it would make your muscles really tight. And, you couldn't even do different activities like play ball and all the rest. It would be detrimental to do that. And so they would consider anybody who lifted weights like, just, I don't know. It wasn't a good connotation in either way. They would just say, nah, you look like a gorilla. It's going to make you, look bad and all the rest. And then you start realizing no, that's not even close to being true. And then when you look at what I'm going to say now, and most people don't even think about this, but I want people to say, wow, that's true. The right side of your brain controls the left half of your body. And the right side of your brain is the creative side of your brain. The left side of your brain controls the right side of the body, and it's the analytical portion. So, for example, if you're creative, if you're an artist, then you use mostly the right side of your brain. If you're more like, let's say, a person who's an attorney or who's an accountant, you're going to be doing more stuff from the analytical portion of your your brain, which is the left side. The key with weight training is you're strengthening left and right sides together equally at the same time. So you're stimulating right creative brain activity and left creative brain activity and basically creating a nice balance between both sides. So you become very creative. And at the same time, your analytical mind is really there like 100% too as well. So it's a way to really get a good balance in the body, utilizing left and right sides of the body to work out, which stimulates left and right sides of the brain at the same time. So you want to get more creative, you work out. You want to get more analytical, you work out. And then, and that's what you really want to do. And so when I'm looking at weight training, to me, it's like, it's intense. It's really, you have to understand all the different muscle groups. Thank God that being a chiropractic physician, I took a lot of anatomy, physiology, syndesmology, and all the rest of that stuff, all the other ologies that you can think about. So I had a really good understanding of how muscles and joints and everything reacted and interacted. So that was great. But if you really want to understand like how the body really works, the more you learn about the body, the better off you're going to be. So that's something that nobody ever talks about, the creative right side of the brain and the analytical left side of the brain, how you can stimulate that and make yourself smarter. That's the best part. I mean, to me, it was like when I was training with the weights and stuff, I'm here, I'm teaching, I'm writing books, I'm training patients, I'm raising a family. And it was kind of like, and pretty intense stuff that I was doing, but I was able to do it. And I think a lot of it had to do with, this kind of training with the right and left brain's ability to work together as a team to make you more intelligent. And that's what you really want to do. And then,
that's interesting for sure.
Yeah. And most people never talk about that. They never talk about it.
No.
Yeah. So I do. And then also it improves your self-image. Most people have a problem with their image. It's like, they look in the mirror and they don't like what they see. And so as soon as you don't like what you see, guess what you feel like? Crap. So, and that's what people do. And so they'll hide themselves. They'll hide their image with clothes, but that's not good because you can just hide so much. So, and then improves your self-esteem, how you feel about yourself. I mean, it's like, if I get up and I look and I like what I see in the mirror, okay, then I feel much better about myself. I feel like, okay, I'm really making my body look good. I know that I'm eating properly. I know I'm exercising properly. And I know just mentally, emotionally, I feel so much better. And so these are great, like self-image, self-esteem, big time, because this all has to do with your physical appearance. And increases sex hormone production. How bad could that be? You take, if you train with weights, and this is when I was working out, a lot of people I trained with back then, they were in their 20s and 30s. I was more in my 30s and 40s. And they were all taking steroids. And I didn't like to do that because I knew like the impact that sex hormones with testosterone and stuff would have on the human body. And it would basically decrease my testosterone output if I did it too early. So, but when you're training with weights and you put on 15, 20 pounds of muscle, the only way that muscle could be there is you increase testosterone levels, free testosterone, total testosterone. And the same thing with women. It's basically, instead of your hormones, impacting, again, especially with women, when they start going through menopause, they start to have really big problems with their hormones. They can't sleep. They're having problems with emotions and all the rest of that stuff. And if you could basically start increasing your sex hormone production, that would help improve overall, let's say, feelings, or let's say remove a lot of the symptoms that you would normally have because the hormones are so low. And also, there's another big thing that you very rarely ever hear. It increases beta endorphin release, giving you a natural high. So when you're working out and you're getting the pump and you start to get, the burn in the pump, and you look in the mirror and you look like, I feel great. I want to feel like this all the time. That's the beta endorphins being released from your whole central nervous system. and it just gives you this natural high feeling, like a run is high. I used to run a lot, and then when you run the 8, 10, 12 miles, for the eighth mile, it's like you're feeling like really good. You can go as long as you want, but you just get that natural high feeling,
Mm.
and
They
that's pretty
always say that
important.
when you work out, your endorphins are higher, you feel better, you
Yep,
have that high, you get that rush from
that's it.
the endorphins from
Yeah,
working out.
exactly, and it stimulates the immune system.
Yeah, just
Yeah,
relax.
yeah. Once you get the immune system functioning really well, it kills everything.
Mm.
I give you an example. When the COVID thing happened, uh, I didn't like take any shots. I definitely wasn't taking any shots, but as time went on, it was like maybe 2 or 3 years into the COVID. My daughter got married in Italy, and it was right at the very end, and they were like they were just opening up again. So, but for me to go to Italy, I had to do a COVID test, and the
Mm-hmm.
COVID test would tell you how many antibodies that you had for the COVID virus.
Mm-hmm.
Okay. And the higher the antibody level, the less chance you're going to have any kind of infection, because the antibodies would kill the antigen, which is the COVID virus. So my antibody levels were, I think I went up to 2,500, and I was higher than 2,500. They didn't go any higher than that, which meant that I had so many antibodies against the COVID bacteria that if they came in contact, they didn't have to come in contact with my body. They would be destroyed. So it's kind of like, you build your immune system up. It's kind of like, if you have a fish tank, if it's dirty and filthy, you don't inject the fish with some kind of antibiotic or some kind of, vaccine. You clean the tank. And that's what you want to do. You want to clean out your internal environment and make it function and make your whole immune system stronger. And people don't realize that your whole body is an immune system. Your skin, your blood, your lymphatics, your lungs, your colon, your kidneys. Your whole body is just a whole immune system. And you have all your antigens and antibodies and all the rest of that stuff that goes along with it. And you can just destroy anything and everything as long as the immune system is functioning really well. And that's what you really want to do.
Mm-hmm.
Also, um, this is another important thing. Structure governs function. And again, people don't even think about this. And function governs structure. For example, if your structure is out of alignment with your
Mm-hmm.
body, your physical body, that's going to govern how it's going to function. So if you have like a problem with your sacroiliac joint that's out of alignment, then you're not going to be able to walk properly. And then the same thing with function governs structure. You start walking improperly, and that's the way you function with your low back, then the whole structural portion of your pelvis, sacroiliac joints, the lumbar spine, and the hips, they're going to basically cause damage to those as well. So when you're training with weights, that's exactly what you want to do. You want to make sure your structure is really in good shape so it can govern function, and then make sure that the function's really well and it'll govern the structure. So it's a nice way to get both of them together at the same time.
Mm-hmm.
And there's something called brain plasticity and muscle plasticity. For example, I'm not sure if you know this, but if you're a child and you were born with half a brain, like you
Mm-hmm.
just had just the left side of your brain developed, but the right side didn't, your body
Mm-hmm.
will create, they call it brain plasticity. It'll create all the neurological pathways to the whole brain so it can function as if it's a total brain. And you won't even notice that there's half a brain missing. And the same thing with muscle plasticity. You could have a joint that's totally out of alignment and, possibly damaged. And by the proper exercises, you can recreate and remold and reshape those muscles in that joint so it can become more functional and pain-free. The body has a way to really do that. So as long as because people go, oh, I can't exercise. I have a herniated disc or whatever it is, or I
Right.
have, a problem with, my knee, and I have, some problems over there, and I might have to have my hip replaced and all the rest. You can basically recreate the muscles and the tendons and the ligaments and the joint itself to basically rebalance itself and be fine. I've seen people with horrible spines and have no pain. I've seen people that have spines that look pretty much fine and they're in severe pain. So it's
Yeah.
just getting that whole thing to work together. And then,
But
you must have it. Go ahead.
So this can be completely off and inaccurate, but is that kind of like scoliosis and
Yeah,
things like that with your spine?
correct.
That is really that it. Okay.
Yep.
So,
Yeah. That's the, like, for example, it's like, if you go look at the first one, structure governs function, it's like, let's say you have a scoliosis, well, that's going to govern the function of the spine. And then, so if you want to then take the function of the spine, and if you can kind of rearrange certain things and exercises, you can change the structure to a certain degree. And at least make it functional so you can do the different things that you can do without traumatizing the scoliotic patterns with the, whatever part of the spine that the scoliosis is in, or it could be tertiary, which is cervical, thoracic, and lumbar at the same time.
wow.
So, and then your body is three-dimensional. You want to train it as such. That was the one good thing I learned about weight training or bodybuilding. And I use bodybuilding not so much for competitions, but a way of life. It was, look at your body. It's three-dimensional. You want to train it that's the way it is. If you can do that, then you'll start to really see changes in your body. But it takes some time, it takes some energy, and takes some effort to do that. And so again, no more counting reps, a waste of time, and most of the time you forget what rep you're on. So we use those monitors that we talked about, which is you should feel the burn, which is a buildup of the metabolites in the hardworking muscle. And by the second or third set, you should feel that. Then the pump, which is to feel the pump, blood rushes into the muscle groups, causing the tightness in muscles and surrounding skin, and that should follow the burn. And when the pump starts to fade, you're done. And then which means that when the pump starts to go, the glycogen storage and the fatty acid stores are done. They're finished. You can't do anymore. So don't push it. And so that tells you, like, this is what you're supposed to feel when you're working out. You work the muscle out. And then this is when you're supposed to stop. And if it's 20 minutes, 40 minutes into the workout, that's when you're done. And the next day your muscles should ache and they have the soreness. Sorry. Back there. Good. And you have that soreness and be present when you touch the muscle. And that's what you just want to feel. You don't want to be able to, say, I can't lift my arm today. I worked out too hard. Oh, my legs are killing me. And you don't want to be that way. You don't want that to happen. And then always increase your weight in each set until you max out. And when I say max out, it's each person's unique and different. And you don't want to get to the point where you still want to maintain X amount of reps if you're female, and you don't want to get into a situation where you can't even lift the weight. You can only do 1 or 2 reps. That's not good. And you must always take each body part through each of its range. And that's another thing I do see with a lot of people. Their range of motion is not there. They're just trying to focus on lifting the weight, and they're not putting the proper range of motion into that joint, into that muscle, to the group of muscles that they're working on. And never here's the other thing I see all the time, Lela. Never use momentum or gravity to move the weight. 6 to 9 seconds is kind of like the amount of seconds you should do for a whole complete repetition. That's the positive and negative phases. So always feel the muscles that are involved with that exercise. So, and again, I see people when they're going too heavy with the weight, they're using momentum, they're trying to push the weight up too fast, or they're using gravity to just drop the weight down. And the more you use momentum and gravity, the biggest thing is you traumatize joints, but you don't work out the muscle the way you're supposed to. So when you go heavy, that's what people do. That's why I recommend just stay light to moderate weight, and you will need momentum and gravity because they're going to cause damage to the body. And then you're never working on one body part, but the whole entire body, and focusing on a particular body part or parts at the same time. As I said, when I'm exercising, I'm really working. I'm standing there with good posture, and I'm kind of contracting my whole body, and more specifically, that portion of the body that I'm working at that particular time. And then the spinal curves, and I see this all the time. I see people when they're working out, they bend their head forward. And that's not good because you have something called a lordotic curve in the neck, which is something that if you don't maintain that, you're going to cause damage to your disc and damage to the soft tissue and damage to the nerves. So your lordotic curves and kyphotic curves. And the kyphotic curve is exactly opposite to lordotic, and it's found in the lumbar spine. And the kyphotic curve is found in the thoracic spine. But you have to maintain those curves, and if you don't, then you're gonna hurt yourself. And I see people working out with their head down and or to the side. They're talking to a friend, and I'm like, you're damaging your neck without knowing it. And the nerves that come out of the neck that feed your arms, they're going to be compromised too. It's called the brachial plexus, and you'll lose strength as well. So and like I said, I see people training people. I see trainers doing that, and they're not even paying attention to the person's form or technique, or make sure the curves are basically the way they're supposed to be. So these are all things they see all the time with people. It's not like you see them every once in a while, you see them all the time. And so regardless of your position, lying, sitting, standing, when doing any exercise, you must have perfect posture, form, and technique. And if you do that, you're going to create the perfect body for yourself. And breathing. So obviously inhale in the negative phase of a rep, exhale in the positive phase of a rep. I see a lot of times when people, they don't breathe. They're so interested in lifting the weight. They just hold their breath.
And they say that you need to learn to breathe a certain way when you're working out, because if not, you'll get tired faster and not even be able to do the movements you should be doing. And it's good that you mentioned number 11 with spinal curves and how people are injuring or potentially doing damage to their neck, because a lot of people will never know that. And you mentioned form earlier and how important form is. And sometimes you can be so caught up in probably thinking about one thing that no one's thinking about their neck or what they're doing with their head. You're so focused on your body and what your body's doing that your neck is something I feel like people wouldn't even really think about.
Right. Definitely. So anyway, we got the breathing down, and then, so our goal is not to annihilate the body, but to stimulate the body. Lee Haney, 8-time winner of the Mr. Olympia. 15, in creating the ideal physique, you should have an idea of what they want to achieve aesthetically, which is spelled wrong and functionally. You're always contracting, relaxing, and elongating musculature during any exercise. The other fighting without fighting, it's Bruce Lee. One time Bruce Lee was one gentleman was trying to egg him on into a fight, and he didn't want to fight the guy. So he says, so the guy asks him, well, what's your technique? He goes, fighting without fighting. And the guy goes, well, what do you mean by that? He says, here, I'll show you. He says, well, when we get into this boat, we'll go over to the island over there and we'll fight it out. So the guy goes, okay. So the guy gets into the boat, and Bruce Lee takes the rope and just lets it go. And the guy's now floating away. Okay. And that's what he did. That's fighting without fighting. And the same thing with me was when lifting heavy weights. It's the art of lifting heavy weight without lifting heavy weight. Muscles do not know how much weight they are lifting, but they know how hard they're working. It's kind of the same kind of situation. So you don't need a lot of weight to make everything work harder. And then there's some home care techniques that you can utilize. And, you can use some of ice packs. You can use, hot showers, and you can use all different things that we talked about there. And deep breathing, what we just spoke about, and purpose to relax your mind and body, realign the joints and increase oxygen flow to the body. And 1 or 2 times today, or per day, I should say, and let 10 to 15 minutes. And it kind of gives you a whole explanation of some of the things you can do for home care as well. And please add the following supplements.
And this is what we talked about in the beginning. So while lying down in a comfortable position, breathe in through your nose and count of 5, and exhale through your nose for a count of 10. As you exhale, focus on relaxing the area of complaint, and you will notice that after 5 to 10 minutes, you'll feel better.
Yep. Good. So, and also from diet, refrain from or consume less of the following because they excite pain: caffeine, decaffeinated coffee, white sugar, soda, candy, white salt, white flour, and alcohol, and processed meats. You may consume frozen fresh vegetables, eggs and natural cheese, whole grains, beef, veal, lamb, and pork, fish, and fowl. And then you've got the rollers and stuff like that, Theraguns that you can use, and sticks that you can help the whole thing. And that's pretty much how you take care of the physical aspect of the body as far as conditioning it.
Oh, I remember growing up, my mom had one of these, and she would use this every day, that stick. And it helps, especially just like we said, even sitting down and doing it, or like you said, stretching while you watch TV, she would always roll with this stick all the time.
That's
And it kind of hurts too a little bit if you're not used to
but
it,
it
but
helps.
you have to build up to it a little bit. Thank you so much, Dr. Cima. It's always great to talk to you. I feel like I learned so much. I know I'm going to start doing some stretches tonight because I might have to start on the floor. But this conversation definitely reminded us that physical health does go far beyond just relieving pain. It's about rebuilding stability, movement, and true functional strength. So thank you so much for showing us more about the physical pillar of the triune. And when it is properly supported, the whole body can really start to heal and perform at its best. So be sure to follow this show and make sure you don't miss our next episode. And we'll see you next time.